Hello, this is Dr. Lewerenz, Longevity Health Institute. Hope this finds you well, educates you even better. So I'm going to give you a few tips about premenses or your premenstrual cycle. Now, that may sound funny coming from a guy, especially middle-aged, but here at Longevity Health Institute, we practice a balanced approach to personalized functional medicine. One of our biggest systems we work on, and I've done for over 20 years, is hormones. Whether you're 20, whether you're 40, whether you're 50s and menopause or beyond, we're always looking at and really diving deep into your hormones and hormonal balance, whether you're a man or a woman. But let me focus today on premenses, premenstrual cycle issues, and I'm going to give you some take-home tips, so share this with others. If you listen to this and this isn't in your age group or it doesn't affect you, I guarantee you know people that it does affect, whether it's your daughters, whether it's your sister, or whether it's a friend, and share this with them because this can increase your quality of life dramatically. And I mean, literally, you hear this message, you follow a few simple things I'm going to tell you to understand about your cycle, and I can guarantee each cycle will be better, better, better. And if you need further help, our doors are always open. We always accept new patients. Me and my practitioners here at Longevity Health Institute doing the best in functional medicine and personalized medicine. And essentially we do a lot of hormone replacement also because that's a big part of our operating system that we look at with you. So let me give you a little bit of background of the menstrual cycle. This is real basic. I wrote a few notes out here in a little diagram, but here's the menstrual cycle, regardless of age, days, day 1 through 28. Okay, this is around day 25, 26. This is estrogen. This is progesterone. Okay, so you're spiking more estrogen in the early part of your cycle. There's technically here, I should have drawn it, a little bit of a slight increase in ovulation of testosterone mid-cycle. Okay, and technically that's your testosterone is around the mid-cycle, but it spikes there a bit. Obviously, it increases libido, increases with ovulation, and increases the chance of fertility. But what I want to explain about your cycle is this. So what happens, what are the main symptoms? And today I had a case like this that somebody referred their daughter to me that was in their late 20s, I think about 28. And this was the issue. Extreme fatigue, okay, premenstrually, extreme mood irritation, and also, times acne flares. And again, she's not a teenager. She was in her late 20s. And so I want you to understand what's happening. So what happens here is, again, here is day 1, day 28. You're increasing estrogen and it falls throughout the cycle, which then brings on a menstrual cycle. Progesterone spikes and brings up mid-cycle and actually is the latest hormone to fall, and that's why you bleed, because then no estrogen, no progesterone is there. And that's right around your day 28, okay? Testosterone is present essentially the whole time, and there's a mid-cycle around day 14, 15, 16 spike. Now, everybody's a little bit different. You can actually spike testosterone a few times. You can ovulate more than once, okay? But here's the key thing. What's going to cause in your cycle major mood issues, what's going to cause in your cycle big fatigue is two things. One is the extreme change of hormones can cause a big effect. So depending on age, depending on what's going on, the pituitary, the thyroid, and adrenal axis can be very affected. So that has to be evaluated. But this is some basics that you can take home, and I'll tell you exactly where to get them, and it can improve. Mid-cycle, when you spike testosterone, after that, there's a little downslope there. That downslope can cause a little bit of fatigue, okay? You definitely, though, will cause a bigger downslope in progesterone and estrogen around day 26 to 28, okay? And this is going into your menses, okay? And that can create what we call a testosterone dominance. Testosterone is present, this progesterone and estrogen drop off, but testosterone here remains dominant. So around day 26, 27, 28, testosterone's dominant, the rest of your hormones are falling off, okay? What does that do? Well, that can make you irritable. make you anxious, make you not sleep as well, make you actually, during that part of your cycle, actually hot flash at night especially, but can make you very irritable. So here, mid-cycle where testosterone is beneficial, good libido, good mood, good energy, it can have that same dominant negative effect later in your cycle. Now, this is prominent if you have adrenal fatigue, if you're stressed, you're not sleeping well, you got a lot of emotional or psychological stress, a lot going on in your life, your testosterone will drop, or excuse me, your progesterone will drop even more, and there's a big discrepancy in this, okay? What's gonna help this though? Well, studies have been done that have shown that your iron levels, yes, I'm changing it here a bit, your iron levels in women tend to be lowest in the later part of your cycle. So your iron store, something you can check in your blood called ferritin, okay, your iron store will tend to be lower. So here where you have low iron, okay, what happens also? You start your menses. You're gonna drop hemoglobin, you're gonna drop your iron even more, and you can get extreme fatigue, okay? So I have many patients, whether they're in their 20s or 30s or what have you, we really track and follow ferritin, it's your iron store in your liver, and we make sure their ferritin and their iron store is good. I also have them around day 24, 25 in this, if they develop this major fatigue pattern at the kind of going into their cycle and during their cycle, is I actually have them really increase a chelated buffered type of iron, so it's very absorbable and good on their stomach. I'll tell you exactly where you can get it in that, but you can take it throughout your month, but I have them double or triple around day 25, 26, 27, 28, and this way through their cycle, their energy is real good. The other thing is you get a lot of myomectal or myometrium, the part of your uterus that causes bleeding, contraction, you get a lot of cramping here, okay? Testosterone's dominant, your myometrium, your muscle of your uterus is actually fed by testosterone. There's a lot of muscle interaction, okay? And the mitochondria are really working hard to get tissue out, okay? Taking magnesium, particularly magnesium malate and glycinate or biglycinate, and I can tell you the type and where to get it, but that also here around day 25, 26, 28, when you're testosterone dominant, it definitely smooths out things like pelvic cramps, heavy, painful periods, irritability, decreased sleep, things like this. It can really benefit you here at the end. So iron, and I'll talk a little bit more about that in a second, but iron and magnesium can be wonderful, easy things to really augment and improve your menstrual cycle, okay? Because this is natural, this is what's happening, okay? Some women are worse than others as far as their fluctuation of hormones, but this is real and this is going on. Unfortunately, one of the things that happens is the older we get or the more adrenal stressed we are, we start dropping more and more progesterone. So it starts falling off here even earlier. We start dropping progesterone even around day 23 or day 24. And so you become more and more testosterone and estrogen dominant, and that can have a big impact on this, what I'm talking about, meaning pain, cramping, sometimes heavy periods, irritability, poor sleep, hot flashes at night. And again, studies have shown, and I see it here in the practice, lower iron going into your cycle. So terrible artist. But this can actually make a big difference in your overall function and quality of life and you know, health. And I say health because iron, if it drops too low, you don't get efficient feeding to your thyroid. Iron is essential for thyroid production and thyroid function and function optimally. So again, very important, simple stuff. So where can you get iron? And by the way, total separate talk in one of my other videos, but leaky gut, digestive issues can cause malabsorption. You can innately have low ferritin all the time. I like ferritins to be 50 and above. Often we find people when they're menstruating around 10s and 20s, good optimal levels around 50 to even 100. But you can have that checked by your doctor. Now, here's the thing, is this gets a little complicated if you got a lot of hormonal issues. Again, here at Longevity Health Institute, myself or my other practitioners are really happy to see you and will really get you on course and on point to get this corrected. Your improvement in health will be dramatic. But the important thing is your quality of life and happiness will really, really, really be noticeable. But where do you get this stuff? Where do you get? So let me say this again: iron, you want to get chelated, buffered type of iron. Now we like to use a product that is called Ferroshell. You can call our office. You can go on our website. You can go to our warehouse. It can be drop shipped to you. The dosing depends on your labs. Most people will put on it 1 or 2 a day, sometimes 50, 100 micrograms. You can take more, just depends, but this type is very absorbable. Again, buffered, chelated, and it's easier on your stomach. Over-the-counter iron will constipate you and give you a lot of stomach cramps. So be careful with that, okay? Again, you can call our office, 248-289-6643. We'll tell you where you can get it. You can go on our website, longevityhealthinstituteinc.com. Go to the supplement shop. The password to order stuff is health. And all our stuff, all our products that are GMP, professional medical grade products, including Ferroshell, is on there, that good iron supplement. The other one is magnesium malate or biglycinate. These are the type of magnesium that absorb well, your body tolerates, and your myometrium and muscles of your pelvic floor and uterus relax. And the dose can be, fluctuating and adjusted. Low end is maybe 300-400 milligrams up to 1,200 milligrams. I like to take it all in the evening or at night. The reason is you sleep better, you have less cramps at night, and people are calmer and sleep a little deeper. And again, you can take that at any time, but you mostly want to focus on these levels, taking it at the end of your cycle, okay? But again, most important thing is have your doctor or have us bring it up to us that we're measuring your ferritin, we're measuring your iron, making sure you're not anemic. And most importantly, a good doctor is looking at the functionality and balance of your hormones. Hormones are an operating system. They communicate with each other, and hormones are all about balance. But if you want less pain, you want an easier cycle, a smoother cycle, less mood and irritability, and also better energy, make sure you check and take iron, we like Ferroshell, and magnesium, particularly magnesium biglycinate. We like to use one called Ultramag. And again, you can get it on our supplement shop, longevityhealthinstituteinc.com, or just call our office, 248-289-6643. We have offices in Rochester Hills, Michigan, and in Madison Heights, Michigan, and yes, I say this often, but this summer, Bloomfield. So always here to bring you, the best and functional personalized medicine, and the key thing here is balance and keeping you optimal. This is Dr. Lewerenz. Love each other. Be well.